Hello, my name is Michael Wood. I am the NHS Local Growth Advisor here at the NHS Confederation. The Local Growth Agenda really started in 2010 when the new government issued a white paper aptly named Realising Your Place's Potential. This spoke about giving powers down from the centre to local communities, to local businesses, to local citizens. These are economic powers which therefore relied on economic governance being passed down from the centre to local areas. So we saw the formation of local enterprise partnerships, we saw 39 new economic areas designated across England, and since then we've seen a raft of city deals and local growth deals and different funding mechanisms at the local level. It's important for the NHS to know that wherever they are in England, whether urban or rural, they are part of an economic area. There is a local enterprise partnership for that area, and it will have designed and published a strategic economic plan which sets out the economic profile of that area, its strengths, its weaknesses, its focus for the coming years, and where it intends to direct investment. This is a key part of the role of a local enterprise partnership, increasingly with our combined authorities. And the NHS, to understand the decisions that are being made locally across its area, its economic area, it needs to understand that there is a strategic economic plan and it needs to understand how to influence it. I often reflect on 5 particular areas where I see the health sector being a major partner. First of all, I would reflect on our estates. Vast estates which we maintain, which will be a big part in the local planning of any economic area. Think about our value with our links with research and the commercialisation of that research and how that attracts businesses around medtech, digital health, life science. We are the biggest employer in any local enterprise partnership area in the country, and we also determine employability is an outcome of the healthcare we provide, so a huge factor there. I think we tackle and we really understand how the determinants of health can try and inhibit employability, so we really put a lot of focus into our public health and tackling social exclusion, which is an incredibly valuable economic activity. And the last one, of course, last but not least, the local spend we have. So how much of the local pound your hospital, for example, spends stays locally. That's a really important part of understanding your influence in a local economy, is your local spend. So I'm here to speak to NHS leaders, to speak to commissioners, to speak to providers, to tell them about the external context in which they're operating, to help them understand the parts of their services and the parts of their organisations which can better influence these external organisations, and to bring benefits to the NHS, to bring the NHS money, to bring the NHS influence, and to improve the public service provision which our communities receive.